initiate Medicaid expansion. And then it's going to cost maybe $50 million to $100 million a year to keep it going. And you know, Alabama is a poor state, we just don't have the money. And so when we first came 7 years ago, the state could have expanded Medicaid, and for the first 3 years, they wouldn't have had to match any money. Every state that expanded Medicaid got 3 years of free money, and then it went up over 4 years to 10%, which is where it is now. But so we went and talked with Congresswoman Terry Sewell. We went and talked with Senator Doug Jones, and they said, well, we'll try to include an incentive in the CARES Act for states like Alabama to catch up, to have a second chance, to have the opportunity to expand Medicaid on the same basis that other states have. And they tried to put it in the CARES Act. It didn't quite happen. But there is a provision in the American Rescue Act, which is the act that gave us the $1,400 stimulus payments and additional insurance coverage. In there it says that any state that has not expanded Medicaid can expand Medicaid, and they will get an additional 5% reimbursement from 77% to 82%.
I can't hear you.
77% to 82% on each person who's currently enrolled in Medicaid. So the state of Alabama has an incentive. If they expand Medicaid for the poor working adults who don't have it now, 300,000 people in the state of Alabama, the resources of the federal government, HHS, will reimburse states an additional in the American Rescue Plan, those states who have not expanded Medicaid get a 5% incentive payment for the people who are on Medicaid now, including the people in nursing homes, the elderly in nursing homes, the children, everybody who's on the program now. And the Center for Budget Priorities did the math, and it's over the next 2 years, the state of Alabama can receive $700 to $940 million in additional reimbursement on the existing Medicaid roll if they expand Medicaid. So Governor Ivey, the funds are there. There's no more reason not to expand Medicaid to serve the people. The monies are there, Governor Ivey. What is your excuse now? And we really come to say that 700 people a year before the coronavirus pandemic, 700 people a year in Alabama were dying because they did not have access to medical care. And what we're saying is that, Governor Ivey, you are responsible for the deaths of 700 people a year. In addition to that, 48% of the 11 million people, 11,000 people in this state, 48%, that's over 5,000 people who died from the coronavirus, did not have insurance. So not having insurance, not having Medicaid expansion for the working poor resulted again in a disproportionate number of deaths because we have not expanded Medicaid. So, Governor Ivey, we come to you, we deplore you today. We implore you, please save lives in Alabama. And we heard about all the jobs, 30,000 jobs statewide, economic development that would occur from expanding Medicaid in the healthcare field. All of those efforts would generate additional tax monies to make this program self-sustaining.
Yes.
Make this program work. Every other state that has expanded Medicaid, it was beneficial to them. So what are you waiting for, Governor Ivey? And one of the things that is happening is that the federal tax money paid by people in Alabama is going to provide Medicaid expansion for somebody in Oregon or Vermont, Illinois, Rhode Island, somewhere else. We are actually, with our Alabama taxes, those of us who are fortunate to pay taxes, we are paying for Medicaid expansion for poor people in other states. And that is driving up the cost of health care for everybody in Alabama because we have not expanded Medicaid. And I could go on and on. The last thing I want to say is that I am here as the co-chair of the SOS Health Committee, and I have been involved in all of these issues. But the issue of Medicaid expansion directly affects whether or not we will have a hospital in Greene County, Alabama, a rural county in the Black Belt, a rural black majority county in the Black Belt. And this whole question of Medicaid, if 40% of the people who come to our hospital have no insurance, 40% of the people who come, we treat them, we minister to them, we give them health care. And we have been running a deficit of $100,000 or more a month providing uncompensated care. If we had Medicaid expansion, Governor Ivey, the rural hospitals would have a stream of income. They would be able to stay open. And those hospitals in areas like Greene County where the poorest people live would have the greatest impact in terms of a stream of income. So what are you waiting for, Governor Ivey? What are you waiting for? It's time to expand Medicaid now.